Men, you all play an important role in our community. And this month, Fox 40 is all about making sure you are healthy and happy. So in tonight's Closing the Gap segment, we have a two-part series. I recently sat down with Dr. Justin Turner with UMMC to talk about men's health. We talked about some great ways you can take better care of yourself. June is Men's Health Awareness Month, and the month aims to encourage healthy living and early detection. To talk a little about the month, I'm joined by Dr. Justin Turner. How are you?
I'm doing good. How are you doing, Patrice?
I'm well. How important is Men's Health Awareness Month to you?
It's very important. You know, in the United States, men on average live 5 years younger than women.
Wow.
And furthermore, men visit the doctor half as much as women. So there's a lot of men who are, walking around not thinking that health is that important and not thinking that they have anything wrong. A lot of them think, hey, just because I feel fine, it must mean I am fine. And then you also have a lot of men who feel as if, hey, I'm the provider and I'm busy and I don't have time to see the physician. So it's very important because we want to let men know that a lot of these conditions are preventable and if caught early are 100% treatable.
And how are people in Mississippi affected? And I also find that in rural and poor income communities, they tend to suffer more.
And that's true. In Mississippi, we have the lowest life expectancy in the United States.
When you hear that, and you live in Mississippi as a man, what goes through your mind?
Well, it hurts because I'm a father, I'm a husband, I have a father, I have an uncle, I have a brother. I have so many men that just are part of my village that I'm thankful because I wouldn't be sitting in this chair today if it wasn't for them. But I also know that we have the highest amount of preventable deaths in Mississippi, and I've had an uncle to die of cancer within the last couple of years. I have had other men that I know died early of cardiovascular disease, things that could be preventable. So it's very important when I hear that because I know that where we are now is not where we have to be.
And just talk about the fact that some people think, well, if I'm young, and I exercise, I'll be okay. What's the sense of me going to the doctor? Or if I'm 20 years old, only older people deal with certain conditions and problems. That's not true.
And very important question. So when you look at the top causes of death in men, overall you're looking at number 1 being cardiovascular disease, number 2 being cancer. But I also want to point out that suicide comes right behind that. So mental health is something that impacts men. 1 out of every 5 men will have some mental health condition annually. And when we do the questionnaire, where we test men to see if the answer is yes to things that could suggest that they have anxiety or depression, 3 out of 4 men are at risk for mental health. But compared to women, men are less likely to go and get the help.
If a man is dealing with mental health issues, what should he do? Where should he go? Where can he get the help?
Great question. So he should contact his primary care clinician and or a therapist. Some insurances allow you to see a therapist without a referral, but I advise every man, just in general, to have a primary care clinician, physician, nurse practitioner, that they see once a year. Develop that relationship, to build that trust with that person, and let that person help find someone that will be good for you, because every key doesn't fit every door. And here at UMC, our vision is to create a healthy Mississippi for every Mississippian. So there's every man, there's every boy, there's every person. We are thankful for our team of trusted clinicians that are here to serve. And on our leadership with Dr. Woodward, we're excited to be able to offer so many different services, to include the psychological counseling services, to include helping with quitting smoke.
What if you don't have a primary doctor? What if you live in a rural area and you say, well, I don't go to the doctor, they're not around me. What do?
So if you don't have a primary care clinician and you have insurance, what I would recommend is get in contact with your insurance provider who has a list of providers, whether that's therapists that's in the area or therapists that you can access via telehealth. So UMC is doing a whole lot with telehealth services being offered to patients that are in rural medicine that may not have access, but now with the usage of telehealth, now we can connect those patients and get them the care that they need.
Now, now that you've taken care of your mental health, let's talk about physical health.
Yes.
Talk about obesity. How serious is obesity here in Mississippi when we're talking about men?
Yeah, so obesity is very serious because you have a lot of men who think that they're just big bone. 20 years ago, we were not seeing the amount of hypertension in teenagers the way we're doing now. Overweight, obesity. 40% of cancers are associated with overweight and obesity. And Mississippi has ranked amongst the worst in obesity for at least the last 10 years or so. And if we can get that under control just alone, improving our activity level. Yeah, you know, patients say, hey, you know, doc, I'm busy. Listen, you can be active and exercise 30 minutes to an hour a day, or you can be dead 24 hours a day. So being more active can improve your health.
And when you say active, what can someone do? Especially if they're, you know, they're working a lot. What should they do?
Well, here at UMC, we have just walking trails, people walking outside in the parking lot. So even if you don't have the access or the funds to be able to go to a gym, walking, simple, it doesn't cost anything. You know, you may want to get out there early before, you know, the sun comes out because it's pretty hot. But, yeah, whether it's early in the day or later in the evening, walking is something simple men can do. Men, you know, they want to be buff, so do your push-ups, you know, do your sit-ups. So walking is something simple. But listen, patients say, hey, doc, what type of exercise is the best exercise? I say the best exercise is the one that you can commit to.
What about nutrition? I know a lot of men, I see them in the gym exercising. But what you eat is also important, right?
It is important. So I see a lot of men that, you know, post on social media, you know, their biceps and triceps, and you see them bench pressing a whole lot. I think it's important to point out that while exercise is important and we strongly encourage it here at UMC, your nutrition is just as important, if not more important, because you cannot out-exercise a bad nutrition plan.
Huh? So what should you eat?
It's important to get more protein, fruits, vegetables, and minimizing those excess carbohydrates, those carbs. You got some people who still think that white rice is a vegetable. They think that potatoes is a vegetable, but in reality, no, it's a carb. So minimizing those carbohydrates and getting focused on protein, vegetables, and fruit, and let that be at least half of your diet on a daily basis, can help improve your health.
Dr. Turner, thank you for joining me.
Thank you so much for having me. Let's get healthy, Mississippi.